Every once in a while, about halfway through my cycle, I'll be out on a morning run, feeling great, and suddenly I feel like I'm getting cramps, which used to be very confusing, knowing that I'm at least 2 weeks away from getting my period and having cramps. A couple of times, the cramps very quickly escalated to a death cramps level, and I had to sit down on the side of the road and call someone to pick me up. After the second time this happened, I was really worried that my death cramps were spreading, taking over even more of my life. I happened to have a gynecologist appointment scheduled just 2 days after this. And after telling her how much pain I had been in, she wheeled in an ultrasound machine and took a look. The ultrasound showed a large follicle on my ovary that looked like it had recently burst. And she explained to me that what I had felt was probably a largish follicle or a cyst bursting. That is how I learned about ovulation pain and ovarian cysts. I still don't know why it only happens to me when I'm running. Am I literally bouncing my egg out of my ovary? I am grateful that my ovulation pain and possible ovarian cysts have been very few and far between. Because after hearing my guest's experience, I feel like cramping up while running is kind of a best-case scenario. So what exactly are ovarian cysts? Why do they happen? Why are they so common? What are our options for dealing with them? And why do they get brushed off as normal by gynecologists, even when they're really painful?
What's happening to your body, we don't know, because we've never really studied the female body. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because we've never really studied the female body.
Welcome back to Cramped, the podcast where I try to find answers to my and other people's questions about their period pain. I'm your host, Kate Helen Downey. If you just found this podcast, you might want to go back and start at the beginning of season 1 to get the whole story of my death cramps, the history of women's healthcare, and the reasons why we've never really studied the female body, like the song says. If you'd like to support this podcast, and we really do rely on your support as a completely independent show, you can do that via our Patreon at patreon.com/cramped. Patreon members get bonus episodes, as well as access to our Discord community full of other crampers sharing their own experiences and information that's helped them. And just a quick reminder, I am not a doctor. This is not medical advice. Everything presented in Cramped is my own and other people's personal experiences, as well as research and information that we have found. I am just a research nerd with a uterus and a microphone trying to share vital information I wish I'd gotten earlier. Today, we're talking about ovarian cysts and ovulation pain. And my case study guest has, unfortunately, put in her 10,000 hours on this topic.
Hi, I'm Taylor Hallam. I do architecture. I have my own design build firm in Los Angeles.
And tell me about your period pain, Taylor.
I have a bleeding disorder. It's called von Willebrand. It's similar to hemophilia. I don't clot very well. So my period pain started when I first got my menstruation at 12. I was bleeding substantially more than everybody else.
So your uterus isn't able to clot and heal.
Yeah, for a very long time. It differs person to person. Like some people get really bad nosebleeds from it. My disease really showed up in menstruation.
Did you know you had this disease before you got your period?
I did. Yeah, my whole family has it. So I just basically didn't stop bleeding. It went on for almost 3 months.
You were bleeding for 3 months straight?
Yes, I was bleeding for 3 months straight.
Oh my God.
So I basically just bled out. Kate.
Oh.
And so it was not great. 10 out of 10, don't recommend. On my 13th birthday, I couldn't walk to go the other side of my house. I was just absolutely exhausted. So I went to the hospital and they put me on birth control.
Birth control where you don't get your period?
Birth control where I got my period every 3 months. I would go off for 1 week. And then that was just straight for 19 years.
And that worked okay for you.
It was the only thing that stopped me from bleeding.
Okay.
I mean, I feel like it absolutely affected how my body developed.
But it did stop the nonstop bleeding.
It stopped the first thing, which was get this person to stop bleeding out. I was on 80 milligrams of birth control. They don't make 80 milligram birth control. So I would just take 4 pills a day as a fresh 13-year-old. So I was hormonal,
Whoa.
to say the least. Yeah. And that was for years. And then it went down to 60 milligrams a day. And then it went down to 40. And I was on 40 for like 12 years. If I missed my pill by 4 hours, like if I was just doing something and forgot to take it, I would start bleeding out.
Oh, God.
It was immediate. And like my cramps were horrific this entire time.
Not only are you in so much pain, but you're also like, I will bleed out.
Yeah, it was not fun. And so I was kind of in fear of ever getting off birth control.
Right.
And then because von Willebrand like changes with age and stuff, I was noticing that I wasn't bleeding out if I missed my pill by like 4 hours. And I was like, oh, that's interesting. So I would like push it to see how long I could go without taking it. Don't recommend this. None of this is scientific.
Right.
At this point, I was 31 and a half. I had never had a normal cycle in my entire adult life.
Yeah.
I had been on birth control since I was bleeding out at 12. So I stopped taking it. And then I will say, I immediately fell into a regular cycle. I was like very concerned that I was like, I was just never going to get pregnant or never going to be able to ovulate or anything. And truly, it didn't even take a cycle.
Wow.
And I was pretty regular. It was fun to feel like I was getting to know my body at a big age of 32 at this point. But then I started experiencing pain during ovulation. And I was asking around, and then people kind of were like, no, like my pain is cramps. It didn't feel like period pain. It felt different.
What does it feel like?
The ovulation pain, the best way that I could describe it is it feels like if you put a brick horizontal up inside of you because it like hurts your pelvis. I felt like it was always inside my bones, which I know doesn't make sense, but I was always like, I want to crack open my bones and like rub the inside because it felt so deep inside of me in a completely different way. Like period, I feel like is very localized pain that I was experiencing and very sharp. But then when I would like put a heating pad on, because I can't take Midol or anything because it's a blood thinner, I would just lay with like a heating pad and stuff. And this was like, you could feel it sitting down. You could feel it standing. You could feel it laying. It didn't ever shift.
Yeah.
Weight is the best way that I can describe it. I truly felt like something was sitting inside of me.
I get that sometimes first day of my period with my endo pain, like there's a bowling ball sitting in my pelvis.
Yes, it hurts so much. You know, after 19, 20 years, I was like, oh, okay, I know this pain, you know, and then I was like, oh, psych, here's a new pain. Like, figure this one out.
So it just showed up one cycle.
It just showed up one cycle. I was probably about 10 months out of birth control that it started showing up, and I didn't really understand it. And it became like very apparent during and after sex, and that was not a great feeling.
Was it only the days around ovulation?
That's how it had started, and I was trying to deduce it. And then it's like, that's hard because it's hard to describe all of this via the internet. You don't think they're that low. They're so low.
The ovaries, you mean?
The ovaries. And the weight and the pain was like so down there.
When you see the diagram.
You see the diagram, you really think it's way on up, or it's like you feel like it's at your like rib cage, like at the bottom of your rib cage.
Yeah, by your hip bones.
And it's nowhere near that. It's so much further down. So it was just, the pain was constant. I couldn't stand up. I thought like my appendix had burst or something. I didn't know what was going on until I did. I had an ovarian cyst rupture.
Oof.
And again, I was like, didn't know what that was until it happens. And then you're like, oh, that's something I've never felt before. Like it was so clear. My body immediately was like, that wasn't good.
What were you doing when it happened?
It's always right after sex. And I think it's just because there's like movement and pushing and that kind of stuff.
Pressure, yeah.
The first one that ruptured was painful and I just couldn't like get up. And I was like, okay, I'll just lay here, I guess. I turned on a movie and just laid there. It was kind of like, okay, that one was tolerable, whatever. That was February. And I didn't know that it was a cyst that had ruptured. I didn't learn until September. It wasn't until I could start seeing the cyst that was growing inside of me was large. And I'm not a big person. I'm like 5'2". And so I could see it.
On the outside, like on your belly?
Yeah, like my clothes that normally fit on like one side of my body and then not the other side. And I was like, okay, something's happening. So I scheduled to like see a doctor.
So you hadn't seen a doctor for this until you could like see it outside of your body?
Yeah. The one that I could see, it felt like that one had ruptured. Again, like debilitating pain. I feel like I have a pretty strong pain tolerance and I couldn't move. That's why I felt like I knew that it was a rupture, was because I felt like something went off inside of me. It was like an event that occurred as opposed to like constant weird pain because I was always feeling the dull heaviness of what turned out to be a cyst. The rupturing part is really the part that was like, oh my God.
Yeah.
It was crazy. Like eyes roll back into your head type of pain. I got the appointment with the doctor and I'm thinking that she's going to tell me the cyst ruptured, but everything's okay now, you know. And I went in there and I had never seen this gynecologist before. Mine had retired. And so I was like just winging it. She was terrible. She was like, why do you think that? Why do you think you had a cyst rupture? And it's like, yeah, I didn't know for sure. This is not a pain I've ever experienced. And obviously, I was doing some research. At this point, it was the only thing that kind of made sense because I had been off birth control. And it's like birth control is good about stopping cysts from growing. And so I was like, no, I'm pretty sure that's what that pain was. And she just was like, well, if you actually had your bleeding disorder, you'd probably be bleeding from it. And I was like, what? So she did a transvaginal ultrasound on me. And truly up to this point, she then doubted that I had a bleeding disorder and also doubted that my ovarian cyst ruptured.
It's wild. Like, it's one thing to doubt a self-diagnosed ovarian cyst rupture. Like, okay.
I get that one. Sure, I'll allow it.
But like doubting your clotting disorder? Hang on now.
Yeah, the thing that I've truly known about my entire life. I've had a transvaginal ultrasound before. She was like doing it really painfully, I guess is the best way that I could describe it.
Oh my God.
I've since had them and they're always like, okay, let me know if you're feeling any. They were like, it should be like uncomfortable, but it shouldn't be painful. And this woman could not be bothered with caring.
God, I hope you torched her on ZocDoc.
I absolutely did. But she then is like looking at it. And I'm like, I know enough about an ultrasound to know that that's not what it's supposed to look like. Turns out the cyst that ruptured was not the big cyst. Yeah.
What a twist. There was another one in there.
There was another cyst the whole time.
Your ovary gives you an M. Night Shyamalan twist.
A level you haven't seen since The Sixth Sense. Yeah, it was crazy. But she knew that a cyst ruptured after she
saw it with her own goddamn eyes.
After she saw it with her own eyes, because there's just free-floating fluid everywhere. And so the other thing that, again, no one tells you when you're experiencing this is the rupture pain hurts. Immense pain, intense pain, but it's not long lasting. Like I've had it last 30 minutes, I've had it last 6 hours, but it is like contained within a day. The other pain that you continue to feel after is that when a cyst ruptures, it's either filled with blood or fluid or a combination of the two. And turns out your body, despite being filled with fluids and blood, doesn't like when somebody else decides to join the party.
Yeah. It's like, not that fluid. That's the wrong fluid.
No, not that one. Yeah, a hard pass on that fluid.
Yeah.
That pain, also excruciating, but in a completely different way.
Your body's like sending inflammatory mediators there because it's like, something's wrong. Go fix it, team. And it just irritates everything all around it.
And it was brutal. And that lasts a week, 10 days. You know, it's like a long time. When she was showing me the ultrasound begrudgingly, I made her turn the computer to me.
Good.
When she was showing it to me, I couldn't even see my ovary. because the one that was still there was like the size of a small avocado.
And the ovary is tiny.
I felt like I was walking around with like a ticking time bomb.
Yeah. So what did she tell you? What did this doctor say needed to happen next?
Oh, nothing. They do nothing for you.
I mean, I'm not surprised, but that sucks.
Yeah, she truly didn't even like give me pain medicine or anything. But it was like, you just showed me another cyst.
Yeah. You showed me my future. Give me the pain meds for the future.
Just give me the pain medicine. And at this point, I just wanted to leave. And so she only did a transvaginal, and they ordered me to get a regular ultrasound. And I went 10 p.m. on a Friday night.
What?
By myself to go get this ultrasound. You know, all the cool kids are doing it. She measured it and she could still see all the free floating fluid. And she was the one who told me, because the other woman wasn't helpful, she was saying that typically you feel it on the other side, which is why I was like, oh, it had to be this one that ruptured, because the pain was on my right side, but it was the left ovaries cyst that ruptured, and then the right one was still intact. I truly don't know the science behind that at all. This woman was lovely, this tech that was doing the ultrasound. And so she showed me everything and let me like take pictures and stuff, so that, because she was like, they don't send you these. And I'm like, so you guys just have images of my uterus, but I don't get them?
Exactly. Why don't I get to own that? I pay for it. Why can't I have it?
It's weird. I don't like it. She basically was like, if it was bigger, maybe we could do something about it.
It was too small for them to like go do surgery on it.
Yes. They basically were like, oh, we could maybe drain it if it was grapefruit sized. And I was like, that is a long way to go. Like an avocado is a good size, but a grapefruit is huge. And so I was like, I don't want a grapefruit inside of me. I can't deal with this. Like, I am terrified of it rupturing at any point.
That's like psychological torture.
Yeah.
It's also so insane. Like, you should get to choose
If I want to drain my cyst.
Yeah. Like, what is the risk? And what if I sign off on the risk?
Yeah.
Or just like, good luck, goodbye.
Yeah. I just went home and was like, all right, cool.
God.
I felt like I could feel it growing. It felt like that you just stacked another brick on. September, October was just kind of rough. It ended up rupturing in late October. It was during the World Series. I remember watching the World Series and being like, well, I guess thank God baseball's 7 hours long, because I just didn't move.
Was there something specific you did that made it rupture? Or was it just like, it happened?
It was again sex. My boyfriend is very sweet and was not down with this plan, but I was like, we have to rupture this thing. I was like, if it gets bigger, it's going to hurt more.
Oh my God.
He every time was like, I don't want to make another cyst rupture. And I was like, please, I need this to rupture. I can't have it grow any bigger. It was a constant argument.
That's so much weird pressure to put on sex.
Yes, I know. I felt terrible. It was rough. So then I was like, all right, sweet. I got him out of the way. I don't have cysts right now, you know, golden. And at this point, after having dealt with that woman that was horrific to me, I had also scheduled another gynecologist appointment. And this woman was much nicer, but she basically was like, I'm sorry to tell you that if basically every ovulation cycle you are growing a cyst, you have to do something about it. Because I was so adamant to not be back on birth control. I started doing acupuncture. It was just great in general. It felt really nice. You know, I like had looked up diets. There's a lot of like teas online and stuff. I was trying to do all of these things because I was like, I don't want to go back on birth control. It was so much of my life.
Over the next few months, Taylor switched insurances and wasn't able to get an appointment for an ultrasound to check in on whether there were new cysts. But she didn't actually need an ultrasound for that, because within that time, 2 more cysts burst. And the pain from these ruptures was getting worse.
I've never vomited from pain before.
Oh.
And my body didn't know what to do. Like, I tried to sit up. I tried to lay down. I tried to turn. I tried to go flat. I tried to crunch up, you know, and it was like my body just kept being like, try something else.
Yeah.
And then at one point, I literally just like projectile vomited.
Oh, God.
It was as if someone took like Edward Scissorhands, dipped them in molten lava, and then decided to like make some type of Jackson Pollock artwork with my insides. Truly a pain that at that point I was like, all right, I'm getting back on. I'm doing something.
When Taylor asked about the possibility of PCOS, or polycystic ovarian syndrome, her doctor said no, she definitely didn't have that. but didn't elaborate. Hormonal birth control was the only treatment she was offered.
They basically were like, we're not pushing birth control, but sounds like you got to be on birth control. And so I'm about to start my third packet.
How's it going so far?
I feel more emotional again, but in a different way where it's like I feel more heightened, like I'm just quicker to be snippy and quicker to be sad than I would be normally because I had finally like understood my own body and my own hormones and my own cycle where I was like, all right, okay. But that's the other thing. When a cyst ruptures, it's also full of hormones. And so then on top of it, it was like my skin would break out. I would just be so emotional.
Your body's like, something just exploded inside of you. Like, stop everything. Put all resources towards this.
Yeah, I think I was just stressing my body out a lot. And so, as much as I didn't want to go back on birth control, I finally got an appointment to see a doctor and get an ultrasound. And I am very happy to report that I have no cysts inside of me.
Oh my God,
which is
yay!
very exciting, but also I am like annoyed that the birth control is working.
But it's good that the one option they have for you is working. Because, like, what do you do if it's not?
That's so true. That's a better way to look at it because I was just like, like, what is the plan?
Yeah, is the hope just that this new birth control will kind of like even you out so that next time you go off your birth control in a few years, maybe you won't get cysts, just like you didn't get horrible bleeding after a bunch of years on birth control the first time?
It's kind of like, we'll see, and even they were like, if this birth control doesn't work, just try another one.
On one hand, birth control is amazing. It's such an incredible tool. It's so important that we can have control over our own fertility, whether we get pregnant or not. And that's within our control. It can make it so that you are not in severe pain once a month. And that is huge. That's a great tool to have at your disposal. It's a great option. But I get so frustrated when it's the only option that's given to us. When it's that or nothing, and it's like, I've tried that. I don't like how I feel on that. The side effects are not worth it to me. There has to be other options. So often we get put on birth control and there's no next step of the plan. It isn't like, okay, so I'm on this forever?
Yep.
What happens if I want to get pregnant? What happens if I want to just not be on synthetic hormones anymore? What is the plan?
There's no plan.
Are there questions that you have about your cysts, about your pain, about your treatment that you don't have a satisfactory answer about?
What is the game plan? I think that I want kids, not anytime soon, but like, am I on this for 3 years? Am I going off of it and then being like, in 6 months, I maybe want to start trying to have kids? And then also, if there is something that you can do, is draining it the best solution? Is that something I can advocate for in the future if I were to do that?
Do you feel like you understand why cysts grow?
No. And I also don't know why they ruled out PCOS. So any of those things would be great questions that I would love answered.
Cause we never really studied the female body.
Hi, Taylor.
Hi.
It's 2 days later. I have done some research. I spent like all day yesterday getting to the bottom of this and like digging through so many medical papers and like the NIH website. And I got my mind blown. So I have some answers for you.
I'm so excited.
The first question that I want to answer for you is, why do you have these cysts growing? To answer the question, I first have to go over something that you probably already know, which is just the general how ovulation works. So each of your ovaries is about the size of an almond, so they're pretty small. And they can vary in size, and like they're bigger when you're younger and they're smaller when you're older. But yeah, they're about the size of an almond.
Oh my God, that alone blows my mind.
Okay, wow. Well, strap in.
The fact that I had an avocado-sized cyst.
Yeah. Well, cysts can be way, way bigger than ovaries.
Oh, they can be way bigger, but still.
Just a quick clarification because centimeters are confusing. Ovaries can vary in size a lot depending on your stage of life, your general body size, lots of factors. Normal ovary size can be between 2 centimeters and 6 centimeters. So anywhere between an almond and a kiwi. The average size of an ovary pre-menopause is 4 centimeters. So closer to a walnut than an almond. My bad. Please direct any complaints to whoever it was that decided that women's internal organs should be compared to fruit and nuts all the time. It's weird. It's like a solid mass, and it has follicles, which are like little seed pods almost. And at any given point, you have follicles in your ovaries at all different stages of development, as long as you're post-puberty and pre-menopause. So if you are in the ovulating part of your life and you're not on a hormonal birth control that is stopping ovulation, you have all these follicles at different stages. So the earliest stage, like the kind of stasis, is called primordial follicles. They're just waiting. They're not activated yet. Then you have follicles at different stages of development. So every month between 5 and 20 follicles get recruited to grow into eggs. And also other follicles get recruited to like start growing, which is a process that takes a year.
Oh, wow.
You have follicles in your body that are going to maybe be ovulated in 9 months, 6 months, next month. And every month, out of the 5 to 20 that get recruited to start growing, a process happens where they basically try to pick the best one. And then before you ovulate, you have what's called a dominant follicle that is the biggest one. It is producing the most hormones, and it is the one that is going to get released. And then ovulation is when the egg bursts out of the follicle, and it's basically like a small cyst rupturing every time you ovulate. Normally. And so some people get some pain when that happens, and then the fimbra on the fallopian tube pick up the egg, and the whole rest of the process happens.
Imagine hating women, because this is cool. We're such cool creatures.
This is so cool.
We're planning it. We've got like ones lined up for a year from now.
This is just happening in the background.
I can't. I love us.
Yeah. Even the normal process of ovulation is basically a small cyst bursting. Like, that's normal. And the dominant follicle that bursts is usually between 2 centimeters and 1 inch big. If you've already got potentially a 1-inch cyst bursting, it's understandable like how quickly cysts can grow a lot bigger from that, right? So when something goes wrong with ovulation and the cyst doesn't burst to release the egg, it can keep growing. The egg doesn't pop out. It stays in there. The dominant follicle stays big, filled with fluid, and it just keeps growing. The next cycle, it gets the signals from the hormones to keep growing like it was a regular cycle. And so it expands. The kind of cyst that it sounds like you had and get often, that's called a follicular cyst. When the egg doesn't release and it just stays in there, and that cyst gets bigger and bigger.
That sounds right from what they had told me.
There are other kinds of cysts, like corpus luteum cysts can happen after you ovulate if the follicle gets blocked. A follicular cyst is usually just full of that clear liquid, but it also can have blood in it. Hemorrhagic cysts is the term that I've heard a lot of, like a cyst with blood in it that happens after you ovulate. There's a couple of different things it can be. Also, there's other kinds of growth you can get on your ovary, like there's like little benign tumors you can get, like dermoid cysts. And then, of course, there's ovarian cancer, which is the really scary thing. And they don't worry too much about that until after menopause.
Okay.
So you have a follicular cyst. You know, this egg didn't release. This follicle is just getting bigger and bigger and bigger. And you have all those hormones in the fluid inside. It's like making its own hormones, basically. It's misreading these signals from your body to keep growing. It was already potentially almost 1 inch big when it was supposed to burst and ovulate. So it can get much bigger very quickly. So my question then was like, why wouldn't you ovulate? Is it a mechanical issue? Does it just have trouble breaking the seal? Why would that happen? And it's usually because of a hormonal issue.
Okay.
We have all these hormones at different levels signaling different things all the time. For ovulation to happen successfully, you need to have high enough levels of a hormone called LH, luteinizing hormone, and HCG, which is kind of famous for being the hormone that pregnancy tests read. You need both of those hormones to be pretty high to have like a spike of those to successfully ovulate. And so if for whatever reason your body's not producing enough of them, that might not give enough of a signal to the ovary and the egg to like burst. The other thing that it could be is too much FH, which is a hormone that makes the follicle grow. If you're getting big cysts, that might be too much FH, which is like overwhelming the signals from the LH and the HCG.
Literally never heard of any of these terms before.
Hormones are so complicated and I don't understand them at all, but like I want to. Real quick, this information about LH and HCG and FH came from a 2002 book called Human Gonadotropins by Lawrence A. Cole and Stephen A. Butler, which I accessed through the Science Direct website. I realize it's weird that I say I don't know how hormones work, even though I just said a bunch of really detailed information about it. I did reference a book to find this answer. I'm not completely full of shit. Thank you. When we talk about hormone balance, it's not like, oh, you just don't have enough of one thing. They're out of whack. Like maybe you have enough LH, but you have too much FH, and it's like overwhelming.
And do you test this with like blood?
You can do blood tests for hormones. You can do P tests for some hormones. Also, you can get a sense of what your hormones are doing and what you might have more of or less of by reading certain signals or symptoms in your body. And for you, if you're getting consistent cysts, it might be really useful for a provider to test your hormone levels at different times in your cycle and be able to say like, oh, well, this is really high, but this is not high enough. And then be able to maybe understand what's happening. Basically, you get a cyst because your hormones are out of whack. You either don't have enough LH or HCG, or you have too much FH. And that makes total sense because you just came off of like 2 decades on birth control. And even though like your periods were immediately regular and you didn't have bad period pain, it makes sense that your body is still trying to figure that out.
Yeah, absolutely.
Not quite nailing that balance.
Yeah, that makes complete sense.
Why do cysts hurt so much? You don't often get like a ton of sensation in your ovary, so like why do they hurt? And it turns out like a lot of ovarian cysts don't hurt. Most people have ovarian cysts some of the time and don't notice.
Oh, so jealous.
That's with like the smaller ones. Usually the ones that are under 5 centimeters, you don't get symptoms from them. And they usually just like go away on their own. If you get an ultrasound for some other reason, your provider might be like, oh, you have a cyst, but it's like normal. That's what they're talking about is like, oh, you ovulated and then like it got blocked. It's almost like a pimple. It's like that level of normal. But when they get bigger, when they get to the point of 8 centimeters, 10 centimeters, it's pushing against a layer of cells that's on the outside of the ovary, and it's called the ovarian surface epithelium. It's basically like plastic wrap around your ovary. That's what bursts when you ovulate, and as it's pushing against that layer of plastic wrap and stretching it, it creates a ton of pressure. It might be pushing against your bladder. Like everything's jammed into the pelvic cavity together.
Yeah. Again, very short. I'm a short person. So like it's like there's not a ton of space for it to be expanding like that.
Yes. And so the bigger it gets, the more the odds are that it's interfering with the function of your intestines or your bowels, your bladder, nerves, your pelvic floor muscles. Like it's just causing a problem in there. And so that's why it hurts. Like it's not that there are nerves in the cyst or anything. It's just that it's taken up a lot of space in a place where there's a lot going on.
I mean, that makes so much sense when I was describing, like the pain felt like it was inside of my bones. That makes complete sense.
Yeah. So cysts are super, super common, which is why, like, if you get an ultrasound and it turns out you have a cyst, your provider might be like, it's normal. Don't worry about it. There was one study I found, over 33,000 women, they did transvaginal ultrasounds. 47% had a cyst. And then they did another ultrasound a few months later, and 63% of those people, it was gone. Most of the time, it resolves itself.
I wish at any point, just any provider would have been like, hey, let's check your hormone levels because these things are happening. The second OBGYN that I saw that was much nicer, she basically had mentioned the follicle situation and was like, but if this is what happens to you, then it would keep happening to you, which is why she was like, birth control stops it. I know that birth control is the easiest option, but it would have been nice if one person would have been like, hey, maybe look into these hormones and see what your levels are and everything. To not have it be clear is frustrating.
Totally.
But no, that makes sense. And helps me feel like I have a way better understanding.
I want to answer a couple of your other questions. Also, I want to say it's really good that your bleeding disorder is less than it used to be. In a lot of these publications, they were saying like a little bit of bleeding is normal after a cyst ruptures. It only really might be life-threatening if you have a bleeding disorder. And I was like,
Fun. Perfect.
if you had been getting these cysts when you were first getting your period and you couldn't stop bleeding, like, damn, that would have been really bad. So it's really good that you're not seeing as many symptoms from the bleeding disorder now.
Yeah.
You asked, what are your options for dealing with cysts in the future? Can you drain them? Is it like surgery or nothing? And I found some really interesting things. So for better or for worse, a cyst rupturing is like a best case scenario.
See? That's what I was trying to say. I was like, I need these things to rupture. Like, I don't want them to get bigger. Get out of me.
I think you're right. Unless they're worried that it's cancer or it's a really big cyst, like over 10 centimeters, they don't want to do anything. And here's why. Once a cyst gets big, like around 10 centimeters, which is like 4 inches, which compared to the size of an ovary, which is like an almond-ish, that's huge. Like 4 inches is big. It could cause ovarian torsion. So it could be so big that it displaces the ovary and then causes the ovary to like twirl on its stalk. And that cuts off blood supply to the ovary. It hurts really bad. And you could lose the ovary and it could lead to like infection or sepsis or like all these things. So ovarian torsion is like the big bad that they really don't want to have happen. And then, of course, if there's any reason to worry about bleeding, they don't want that to happen either. But if a cyst is under 10 centimeters and it's livable, it's not causing like really bad symptoms, they just let it be. And they're like, oh, come back and let's check in on it. Because they want to monitor its growth. They want to make sure it doesn't end up being something cancerous. And they want to be sure it's not going to become so big that it twists your ovary. So if it does become like 10 centimeters or over, they will do laparoscopic surgery, usually. That's what's advised. And laparoscopic surgery is a minimally invasive surgery where they punch little holes in your abdomen, basically, and they blow your belly up with gas, and they can look around and cut stuff up, remove stuff, and resolve the situation. It's less of a big deal than like cutting a big hole in your skin and muscles to get in there. But it's still surgery. Like, you still have to be under anesthesia. The recovery time can be weeks before you're feeling normal again. If you're weighing the options between laparoscopic surgery and just letting it burst, which is gonna suck, but it's gonna be like a few hours of pain with like basically no recovery time, and it's not big enough that it might cause ovarian torsion.
And is there not an option where they drain it?
There is, but it comes with a lot of caveats. So the draining is called aspiration. And it's where they take a big ass needle and they like use an ultrasound to guide the needle and they just stick it into the cyst and remove the fluid. So they're like deflating the balloon, basically. It's an outpatient procedure. They just like sterilize it. They don't have to put you under anesthesia. I think they do like a local anesthetic. It doesn't require you to be under, and it doesn't have this like long recovery period. So that seems good, right? But the reason they don't like doing it is because if you just deflate the balloon, the walls of that cyst are still intact. And so the hormonal signals next month are just going to like fill it up with fluid again.
I was wondering about that. I was hoping when they punctured it to remove the fluid that maybe it would puncture the walls. But no, that was my fear as well.
So it punctures the wall, but basically it heals. It doesn't completely get rid of it. And so the recurrence rate is so high that it's like, why bother doing this?
Yeah.
I did read one study, a small study, where they aspirated cysts and then injected something called a sclerosant. I don't know if I'm saying that right, but it's a kind of chemical that basically like collapses blood vessels. So they kind of like killed the blood supply to the cyst. And that had a 90% success rate with no recurrence.
Interesting. And doesn't affect the actual ovary itself.
It doesn't seem to, no. I didn't see anything about that in the study. But that is not a very common procedure. It's also like sticking a giant needle into your abdomen. That requires a specific skill set. It requires practice doing it. I think it's a skill set that not a lot of providers have or offer. And you don't want somebody doing it who isn't an expert in it, because there's a lot that could go wrong there.
Especially with someone with a bleeding disorder. Like, just really not trying to shove large needles inside of my body.
Exactly. When I first started, I looked this up. I was like, oh my God, why isn't this offered all the time? And then between like the recurrence rate and the like risks of shoving a giant needle into your abdomen, it's like, I do kind of get why like that's not an intervention that like makes a ton of sense all the time.
Yeah, that's when they basically were like, it would need to be 10 centimeters or over. And then I think that's just because it's much easier to find a grapefruit-sized thing inside of your body.
And if you do get ovarian torsion, like you have to go to the emergency room and like get emergency surgery. It's very possible to like lose the ovary if that happens. So ultimately, like you can always ask about aspiration, and your provider might know somebody who does that. And if cysts are really causing problems, like you can ask, do you just aspirate, or do you also inject the medication that like kind of shuts down the blood vessels so that it doesn't grow back?
Yeah.
The study I read just had 148 participants, but it did have a 90% success rate avoiding recurrence. Now, that doesn't mean, like in your case, you weren't getting the same cyst over and over. You were having different follicular cysts.
On both sides. So, yeah.
Right. You could get that aspiration done and then like get another cyst the next month. So it doesn't, I get why your provider was like, let's just shut down ovulation and that stops this problem. Yeah, you can't really get a cyst aspirated every month. You can't really get laparoscopic surgery every month. I do think stopping ovulation and waiting and seeing what happens next time you try to go off birth control makes sense.
Yeah, I think next time that would be when I would try to actually have children. I would do a lot of blood work and urine tests and everything and figure out what my levels are and see how I can balance them more.
That can take a long time to even out. When you first get your period as a teenager, it's very normal to have 2 or 3 years where your period fucking sucks. Like where your period is really painful or irregular or just like there's all this weird shit going on. Cause it's literally your body like being like, whoa, look at all these hormones. Like, what are we doing? Like figuring out what the deal is. You really didn't go through that. Like you went through 3 months of your body figuring this out. And then for very good reasons, because you wouldn't stop bleeding, like you had to shut that down. And so it's almost like your body was going through that like puberty almost, figuring it out for the first time.
In my 30s?
Yeah, exactly. And so it makes total sense that it's like, oops, error. Like,
yeah, so sorry about that. Still figuring it out. Yeah, I was trying to be kind to my body because I knew it was doing that, but it is really hard experiencing that as a full-blown adult. Like people give you a lot more leeway when you're 13 and crying from how hormonal you are and the pain you're in and everything. It definitely was a wild thing to do at 32 and 33.
We put so much pressure on ourselves. We're grown-ass women. Like, we need to know exactly what's going on with our bodies. We need to be on top of it and be functioning correctly. And it's like, nah, your body was just trying to figure it out for literally the first time. And you have tools at your disposal, like birth control, that can address this. So you don't have to be in excruciating pain every month. You don't have to be having psychological torture. When is the cyst going to burst? I think that's a bigger part of the experience that we often discount is how much pressure we're putting on ourselves to be functioning correctly, quote unquote, be on top of this, to know what's going on, to be normal.
And then simultaneously going through all of that while still working and still having to do all of these things. It is hard to take care of your body and to pay attention to your body when other people are just functioning regularly.
Yes. One of your questions was like, what's the game plan? I'm on birth control now. What do I do if I want to get off birth control or have a kid? Like, how do I make sure I'm not having these cysts again? And first, your hormones are still figuring things out. You're on a different kind of birth control than you were before. Your hormones might have sorted this out. You might go off birth control and have no problem with this. There's really no way to know until you do it. Also, there are doctors out there who will work with you very personalized care around your hormones and functional fertility medicine. Usually insurance doesn't cover it because like, why would it cover something that actually helps you? But you can find these doctors and these practitioners who are going to like give you the information, help you figure out the best way to track your own hormones, figure out what's going on. And I think that might be a really good option for you because like, often our like regular gynecologists, they're not working in that kind of detail. The stuff that they're looking out for, the levels of hormones, they're looking for things that are seriously wrong, things that are like clinically bad. Like, do you have a disease? Are you going to end up in a life-threatening position? That's what they're looking for. They're not really concerned as much with, are you in pain? Are you uncomfortable?
Your day-to-day.
Exactly. And so I think knowing that, like knowing if you have specific questions and you can ask your gynecologist really pointed specific questions, that can work. They can be a tool to help you get something done. If you're looking to like discover and figure out and investigate, I think functional medicine or like another provider that is maybe a little more alternative is probably going to give you more of that kind of support, which is really important and can impact your day-to-day life a lot more than like a visit to the gynecologist every year.
I mean, now I know the FH thing, and now I know the HCG thing. Like all of that is just literally more information than I've ever been given. To be able to read those levels and know what is more normal or what is potentially creating these cysts inside of me, I think is a great tool.
Yeah. Last tiny thing, we talked a little bit about like, how did your provider rule out PCOS? And it's actually super straightforward. Yes, PCOS is usually, if there are cysts, there are like lots of little tiny cysts. It's not like one big cyst at a time. There's also a lot of other symptoms that go along with PCOS, like excess facial hair growth or body hair growth, weight gain, acne. The big thing with PCOS is irregular periods, because the whole thing with PCOS is it's a hormone disorder. It's not just an imbalance in hormones. It's like a full-on disorder where you are not able to have regular periods.
Like the periods were regular within a day. So that makes sense. Even though it sounds like it's a lot of cysts, it was, but it wasn't a lot of cysts at once. It was one cyst a cycle or every other cycle.
Yeah.
All right, they got one thing right. We'll give it to them. I'm just kidding.
Throw them a bone. Yeah.
Yeah. Thank you so much. This has been so wildly helpful and informative. And I feel like I know my body better and appreciate it more. And it's hard. It's hard out here in these ovary streets. And for everyone listening, I hope that someone else gets to feel less alone and more understood. I mean, I'm just never going to forget that my ovaries are potentially almond-sized. It's freaking crazy. That's bonkers.
Thank you for coming on and telling your story, letting other people hear what you're going through, and letting me spend a full day researching. That was so fun.
Of course, anytime. I hope I don't have other weird things happening inside of my body that you can't actually help me with, but, you know, we can do other things.
Yeah. That's it for this week's Cramped. If you've had an experience with ovarian cysts that you would like to share, we would love to hear it over on the Cramped Discord, which you can join by supporting us on Patreon at patreon.com/cramped. If you would like to share any further information about ovarian cysts or ovulation pain, or provide us with a correction, we would love to hear it. You can reach out to me on Instagram at Kate Helen Downey, or email us at crampedpodcast@gmail.com. Cramped is hosted and created by me, Kate Helen Downey. Kelsey DeLonzo is our editorial producer. Sound design and mixing is by Kelly Kramerick at Maven Post Media. Cramped's incredible theme song is written and performed by Faraday. Our podcast art was created by Nicholas Shepard.
What's happening to your body? We don't know, because we've never really studied the female body.